Good morning, everyone. I'm Dawn Argula, CEO of the Livermore Valley Chamber of Commerce, and I want to welcome all of you to our sixth webinar with Alameda County Public Health Officer, Dr. Nicholas Moss. This is a production that is being done with the Tri-Valley Chambers of Commerce, Livermore Valley, Dublin, and Pleasanton. It's been a year now since we been in our shelter in place and the pandemic began to impact our economy. We are happy to have this partnership with the Public Health Department to bring you the latest information direct from the source from our Public Health Department and our health officer. Before we get rolling this morning, just a few housekeeping matters. The format for the program is Dr. Moss will present the latest information for about 30 minutes. And then for the last about 60 minutes, we open it up to Q&A for our audience. Please enter your comments and your questions in the chat, and we will read those to Dr. Moss when we come to that part of the program. If for any reason during the program, we are operating in the virtual world, and sometimes there are some technical glitches. If we should disappear or our screens freeze, rest assured, we will come out and we will reboot and we will come back into the program. So we appreciate your patience. Before we get rolling, I'd like to introduce my partner CEOs from Dublin and Pleasanton Chamber of Commerce, and for a few opening comments. Steve Van Dorn from our Pleasanton Chamber.
Good morning, everyone. Thank you, Don, and thank you, Dr. Moss, for joining us again. And thank you, Jody Amos, for pulling this together. Look forward to a really positive discussion with all the positive numbers we're seeing. So thank you for being here.
Okay. Inga Houston from the Dublin Chamber.
Hi, good morning. Inga Houston, Dublin Chamber. Thank you, Dr. Moss, again for joining us as well. And Don, thank you for organizing this for the Tri-Valley Chambers. We appreciate the partnership. And Jody, as always, thank you for making us all look so fantastic.
Yes. And Amos Production is producing this webinar for us today, as he has for the last 5. So we appreciate that partnership as well. So I think we'll get rolling here. We want to welcome Dr. Nicholas Moss. Welcome, Dr. Moss, and thank you again for being here with us and for partnering with us and our businesses. And I think we'll get rolling.
Hi up.
Yes, you are.
All right. Thanks, Don, Inga, and Steve. Great to be here. Lots of news, even in the last 24 hours, and so we'll be able to dig into that. Don said I'm going to share the latest information. My slides are about 2 days old, so almost the latest information. But I think the broad messages are going to be the same. We're in a period of improved numbers, reopening, I think as many of you are probably aware, and increasing vaccine numbers. Certainly this is not over. So, I'm going to, include a note of caution in everything that I share, but we're in a better place now than we were when we last spoke, and maybe the last 2 times we spoke. So I have some slides, and I think, yes, here we go. Okay, some key points. So our daily case rate has continued to fall coming out of the winter surge. Our positivities, test positivity, which is a good measure of just how much virus is circulating in our communities, a rough measure, those have also fallen. Our hospitalizations and deaths have decreased quite a bit from the winter surge. The winter surge was characterized by these persistent disparities in who is getting COVID in Alameda County, particularly along race and ethnic lines, but nevertheless, we've seen improvements really across the board. And I'll talk briefly about variants. And as I mentioned, this is not over. Future surges are possible. Next slide, please. Okay, let's try to shield my background here. So this is our daily case rate. You can see this is the pattern that if I showed you any of a number of slides with metrics about COVID in Alameda County, you'd see the same pattern. The summer surge, which was dwarfed by what we saw in the winter, and then this huge winter surge right through the new year. And now just steady improvements. You can see that curve is flattening out a little bit. We're not, improving at the rate we were, but still improving really every day. Next slide, please. I mentioned the disparities. I think this is just something that we have to always be aware of when we're talking about COVID data in Alameda County or anywhere. Rates were highest throughout in our Latino residents and then also in our Black residents. And the reasons for this, we believe, are, first of all, very structural to our economy, to our history. But also immediately, I think, because these are people who are staffing our essential jobs where you have to go out and work shoulder to shoulder with other people in areas of our economy that we really left open throughout this year. And also people who in Alameda County and lots of places are living in more crowded housing with more people in the same space. So that's really what we're seeing. But again, those are products of a lot of upstream factors. Nevertheless, all rates are improving across all of these groups. We're already about a week out from this slide. I will tell you that things have continued to improve. So we weren't able to avert these disparities in the winter surge, despite a lot of effort in the fall. But I'm glad to see that we are seeing improvements across the board. Next slide. So we moved to the red tier. This says today, like I said, slides are from a couple days ago. So that happened Wednesday. I hope you got the memo. Indoor dining is now approved. Movies, indoor museums, gyms, and then also now we're K through 6 was able to open with certain things in place. Now, really, K through 12 schools are permitted to open. I know it's one thing for us to say they're allowed to open, and another thing to get them open. Nevertheless, that's where we are in the state's rule book. Restrictions apply for all of these capacity limits. Gyms, notably, 10% capacity limit. And there's other restrictions that the state has published for each of these sectors. But it is, I think it's a good thing that we're able to get some things open again. I think that, so we have to be in red here for 3 weeks before we can advance to orange, which means essentially higher capacity limits, a few other sectors allowed to open up indoors. I think that's going to happen probably in 3 weeks. I think we're going to get there as soon as we are eligible to move. We will, if the current trends continue. Our metrics are very good. State did announce some changes over the last couple weeks, really even over the last few days. So one thing is the tier thresholds. What threshold you have to meet to advance from purple to red and red to orange. Those are now going to be relaxed if we meet certain goals of vaccination, particularly in low-income zip codes across the state. This is not a county-by-county thing. And I think this actually won't have a huge impact on Alameda County, except maybe when we're talking about moving to the yellow tier, which we've never seen the yellow tier since the state introduced this system. But it could affect us there. I think we'll move to the orange tier regardless of whether they relax that threshold. So what else? Outdoor live events with up to, I think, to start in the red tier, maybe 20% capacity. Assigned seating events. These are assigned seating, not just festivals and fairs. But this does mean pro sports with audiences. That's going to be effective April 1st. We're awaiting some guidance on indoor live events. That will affect some people's businesses, I know. So I'm not sure what the rules are going to be there yet or where things will kick in. Obviously, moving to orange tier will open up a lot. Amusement parks, that affects some things locally, not a lot, but some. More youth sports have been allowed to compete. I know that there's a lot of interest in this. Has been, one of the areas of greatest policy and interest for community members. There's a lot of restrictions there, but there are avenues forward for a lot more youth sports now. Next slide. Switching gears to vaccine, the other big story. We now are at about 500,000 doses delivered to Alameda County residents so far, which is great. I think we're doing very well. We're certainly we're not lagging. I think we're ahead of a lot of places. Over a quarter of residents over age 16 have received at least one dose. Over 10% of our residents have been fully vaccinated. It does take 2 weeks if you're getting a 2-shot vaccine. Remember, there's the 2-shot vaccines and there's the 1-shot vaccine. It takes 10 days or 2 weeks after that shot for the full effect. So when I say fully vaccinated, I mean we gave people the doses. But it does take a while, and if you've been vaccinated or you're about to get vaccinated, just remember, full effect doesn't kick in until 2 weeks after the final dose. Nevertheless, 2/3 of our older adults have received at least one dose of vaccine. So this is really great because if and when we see a new surge, it really will reduce the severity, the impact on our healthcare system, deaths, things like that. Because we've been able to get vaccine in the hands of older adults. And this actually does mirror what has been seen across the country. About 2/3 of older adults have got some vaccine. So there's different ways to get vaccinated in Alameda County. For those who are eligible, we'll talk a little bit about eligibility. There are community points of dispensing serving all the county, but particularly the neighborhoods where they're set up, mobile vans tied to the Oakland Coliseum site, occupational, like specific, emergency worker points of dispensing, things like that. And of course, the big mass vaccination sites, Fairgrounds, Coliseum, and healthcare providers. You can get a vaccine through your healthcare provider if you're eligible and if they have supply and they're able to schedule visits. I didn't add it here, but retail pharmacies as well are able to vaccinate eligible folks. So speaking of eligibility, next slide. This is already pretty much out of date, but this is the where we were for about a month. Healthcare workers, people in long-term care facilities, all older adults, food, agriculture, restaurant and grocery workers, emergency services workers, and education and childcare workers. We're just now pivoting to all these folks are still eligible. They can still get vaccinated, but we're going to be including under the state's guidelines an expanded set of emergency service workers. And then starting, I think, on Monday, it's next slide, please. It's this group of people ages 16 to 65 with chronic illnesses. There's some specific definitions there, but that's going to be a big expansion. And transit workers were included, public transit workers and airport workers were included under emergency service workers overnight. So that's kicking in. So a lot more folks eligible. As you heard, if you were reading the news or watching TV last night, at the federal level, the goal is to have everybody eligible to receive a vaccine by May 1st. I think that's a reasonable timeline. That doesn't mean everybody's going to get an appointment or everybody's going to get a vaccine, but we really want to keep, as we're making progress in each of these eligible groups, opening things up more and more. And we may see things move even faster at the state level. But I do think that we're going to get to a place where, anybody's going to be able to sign up. Now, we don't have a vaccine approved for kids under the age of 16 yet. That's probably not happening till later in the year, maybe summer or fall. Next slide, please. You can see on our county dashboard where we have all our case report data. You can also see our vaccine data. So this is vaccinations delivered to county residents. And I encourage people to check that out. We have data by city, including percentage of city residents who are over 16 who've been vaccinated. I'll tell you, I think Pleasanton is in the lead and Livermore is in second place. Dublin has some work to do. I know there are people eligible in those communities. So anyways, you can see city data at that dashboard. Next slide. We have data by age group on that dashboard. I mentioned some of these stats already. Next slide, please. Data by race, ethnicity. We would really like, at a minimum, to see these blue lines, the percentage of county population by race for each of these groups. We would like these blue lines to be equal. That's first doses given for people by different race and ethnicity. We're actually lagging in terms of vaccine delivered to Latino residents in particular, given the impact, the sheer number of cases in that community. And so a lot of county's efforts is to try to, get these blue lines sort of more equal. To do it equitably, I think we would have the most vaccine delivered to that community. But right now, we're just trying to get people through the door. There's a lot of work that needs to be done in that area. Next slide, please. So I mentioned where people can get vaccine. We can move on. There's a lot of different avenues. And that's going to continue for the time being. Next slide, please. The Fairgrounds, the nearest mass vac site, partnership with Stanford Valley Care and Sutter Health. It's drive-through appointments only. You can't, walk up and just, get a visit same day. Doing about 1,000 doses per day. So pretty big site, not as big as Coliseum, but pretty big. And we're really proud of this site and the partnership. And I'm glad that we're able to get some vaccine out there. And that's going to be operating for the foreseeable future. Next slide. The Coliseum is open. It's open to anybody eligible. We want county residents to use it as much as possible. I know people from outside the county are able to get in there. 6,000 doses a day. This it's a huge increase in the amount of vaccine coming into Alameda County. The county itself, we're getting about 40,000 doses a week. This is doubles that. There are some other doses going to Kaiser and places, but nevertheless, it's a big increase. There is pedestrian access. You can park there and drive-through access. And they have mobile units that we've really been able to use to serve some of our hardest hit neighborhoods. They told us that they don't want to send a mobile unit out to Livermore. I guess it's too far from the home base. I don't really understand that. But anyways, we thought we would be able to get the mobile units deployed out there. And so far that's been a no. But nevertheless, I think that there's a need to deploy more vaccine out in the Tri-Valley area, and we do want to do that in partnership with some folks out there. Next slide. So, people always want to know how they can get vaccine, and I will say, statewide, nationally, and certainly in Alameda County, this is still a fragmented process. I encourage people to check with their medical provider if they think they're eligible. See if their medical provider is signing folks up. You could certainly also check, you can look up the Federal Vaccine Finder website, and we'll show you what the local pharmacy chains have vaccine, and you can make an appointment at those. But I also encourage people to go to the Fairgrounds website, which has links to sign up, and you don't have to be a Sutter or Valley Care patient to get registered through that site and get vaccine there. It's really for all eligible folks. So take a look at that website. Similarly, Oakland Coliseum, if you're eligible, you can sign up at the state's vaccine registration site, myturn.ca.gov, or there's a phone number there. Our county phone number is coming online, I think, next week. You can check our website. There's the URL right there. We're updating information on how people can get signed up for things. This is going to improve over time. I wish it was just one portal with a phone number, and we're just not quite there yet. So it is what it is. Next slide. Let's skip this for now. The most important thing is proof of ID, but it doesn't have to be a government ID. It's really a low barrier for getting people through their appointments. We want people to get through. We don't want to stop and read all your mail every time somebody shows up in line for a vaccine. Next slide. Briefly on the Janssen or Johnson & Johnson vaccine, they're the same thing. This is the single dose, most recently approved one. Great additional vaccine. It's going to mean more options, more supply, highly effective at preventing severe disease and death, even against B1351. That was what's called the South Africa strain sometime that has been concerning for vaccine efficacy. No deaths in any vaccine recipients in the trial. It's amazing that we have yet another great vaccine. People ask, well, which one's better? The thing about all these vaccines is they're all excellent. They're all comparable or better than vaccines that we use for other communicable diseases. There are no head-to-head studies done. They were tested during different times of the pandemic against different viral variants and with different populations. So you can't just eyeball compare them. But what's important is that they're all highly effective at doing what we want to do, which is preventing people from getting severe illness and dying from COVID. And they do actually all seem to be, the data is now starting to come in. They do all seem to be effective at reducing the spread, even of asymptomatic spread of COVID, which is something that we've all wanted to see, and we're really glad to see the evidence start coming in on that. That's why you've heard CDC talk about loosening quarantine restrictions for vaccinated people, things like that. Take the first vaccine you can get your hands on. A close friend of mine lost her father over the winter. He's in his late 70s, but a working, a farmer businessman, outdoors every day. Went to a holiday party, went to a holiday party, got COVID and passed away. And he would have been eligible for a vaccine, within a week or two. And I just, there's no benefit to waiting. Take the vaccine that you can get, and let's get everybody protected. So, next slide, please. Okay, it's not over. We're going to be opening things up. Last time we did this, case rates climbed. It's happening across the region. Things are opening up. It's happening across the country. Some people are, burning their masks because they think it's all over, or they never believe, whatever. This is not over. COVID will come back and it will infect people who are susceptible, and that's most of us. So until we get those vaccine numbers up, we need to be on guard. We need to open cautiously, wear a mask, wash the hands, watch the physical distance. It says wait to see loved ones. I think we're starting to be able to gather a little bit more. 3 households is okay. If you're vaccinated, it's okay, especially if you're around other vaccinated people. But let's. It's not back to normal quite yet, everyone. So stay cautious, hang in there, and vaccine supplies remain limited. So be patient, even if you're now in one of the eligible groups. It's going to take some time. Please be patient. I think that's my last slide. It says final thoughts.
Okay. Thank you, Dr. Moss. Thanks for all that good news. Yes, we are very happy here to be in the red tier. Those of you who have any questions, please enter them in the chat and we will get to those. I want to talk about the numbers for just a moment. I do go to the county dashboard on a pretty regular basis, and I'm looking at it right now, and I see our adjusted cases per 100,000 has dropped to 4.8. Our overall test positivity rate is at 1.8, and our lowest HPI test positivity rate is 2.6. Last week, I think the adjusted cases were at 6.3. So we're seeing these numbers drop rather quickly. It's very promising and very, exciting. So, but we do want to manage our expectations. So first of all, I want to ask about, some of these numbers, we could be in the orange or the yellow tier right now. So how quickly, what is the cycle? I want to be clear on that because I thought it's every 2 weeks, but then some counties are moving sooner than that. So please help us clarify that.
Yeah, it's super confusing, and I've probably read the state's rules a million times, and I still get turned around. And so there's a few important key points. You have to be in a color tier for 3 weeks before you can advance, whatever the metrics say. So you can't go red 1 week and then orange the next week. It just doesn't. You have to be in it for 3 weeks, and that's good because they want people to move slowly. Slower reopening has been shown to delay and reduce the risk of surges. And remember, we had a very slow approach in Alameda County in the fall, and I think that was the right move. We have among the best metrics, I think, in the country in terms of large counties. And but now we're really sticking with the state because the state builds some of that slowness into their system. So slow is good. It's hard for businesses, but it's good. So in order to advance, so that's the 3 week thing. The 2 week thing is you have to meet the metrics for a lower tier. So for us, that's orange, 2 weeks in a row to advance. So once we hit the orange tier thresholds 2 weeks in a row, we advance. We have to hit them for all three of those things that Dawn mentioned. The adjusted case rate, which is actually now down to 4. So we're almost to orange tier, it's 3.9. You don't have that information, but I have that information. So we have to do it for the adjusted case rate and the test positivity overall and the test positivity in our lowest income zip codes. And so once we're in orange or yellow or low or orange or lower for any of those things for 2 weeks, then we can advance. So what does 2 weeks mean? That means on Monday, the state takes a look at all the numbers and they're looking back in time. There's a timeline. On Tuesday, they tell everyone what they saw. They say, hey, you met orange tier metrics. And then they look again the following week. And on Tuesday, if you meet those metrics again, then effective the next day, you can advance to the next tier. Okay, so to recap, we have to be in red for 3 weeks before we can advance, regardless of what the metrics show. We have to hit orange tier metrics for 2 weeks in order to advance. Announcements are made on Tuesday and they're effective the next day, Wednesday. One wrinkle, the state is going to change the thresholds because of this when they meet these vaccine goals statewide. And they may do an assessment on a different day of the week than normal. So that's the one wrinkle. I'm not sure if that'll affect us at all or not. So otherwise, it's a very complicated system, but we are on pace. Take my word for it. We are on pace to be in orange 2 weeks from the coming Wednesday.
Yay. Thank you. 2 weeks from the coming Wednesday. Everybody note that and prepare. But having said that, fingers crossed. So having said that, all of the protocols still remain in place and that we must continue to protect. Wear the face coverings. That has not been removed or changed in any way. I know our businesses are working very hard, have been very responsible in implementing and ensuring that those remain in place to protect their employees and their customers and clients. And so we want to be sure we don't get too far ahead of ourselves and remove those sooner than allowed or permitted. Inga, do you have any questions for Dr. Moss? Looks like Steve's on the phone. But...
Well, I'll read the first question in the chat.
Okay.
What about churches? Should we say who put it in there? Yes,
You could say their first name or
okay.
whatever.
Michael asks, what about churches? We meet outside socially distanced over 15 feet away from each circle. We wear masks in our circles. Can we take off our masks in our circles is the main question, I guess, if they're 15 feet away outside. I'm assuming the inside the circle is a family unit.
Keep the masks on. You got to keep the masks on. Yeah. But I will tell you all, by Supreme Court decision, indoor worship is now allowed in all tier levels in California. So there are some other things have been relaxed for places of worship. Right now in the red tier, 25% capacity indoors. The state, I encourage you to check the state guidance around, there's some changes around singing and how that can work. But please keep the masks on. Just keep them on. Keep on the mask.
So even if you're like outside walking, you should wear your mask.
If you're around other people, 15 feet, 20 feet, 16, just keep the mask on. Let's hang in there. The masks are really making a big difference. We're almost there, everyone. Keep the masks on for now.
Okay. I have a question here regarding convenience stores. And let's see here. When can we expect to see self-serve food and dispensed beverages allowed? Other counties, including Sacramento, are allowing soda fountains, water dispensing machines, ice dispensers, frozen yogurt, etc.
I'm sorry.
Self-serve.
I'll have to familiarize myself with the specifics of that restriction. We're not restricting anything that's allowed by the state. So if Sacramento is doing something because it's allowed by the state, then it's allowed here. And I'm more than happy to look at any document you have that says otherwise. If it's allowed in California, in a red tier county, it's allowed in Alameda County. I don't... and maybe that's what's different about Sacramento. Maybe they're in a lower tier. I don't think they are, though, but I could be wrong about that. So I'm happy to take a look after this call and just see what the restrictions are with regard to those things. But state has guidance and by industry, and that's what is in effect in Alameda County.
Steve, you're back with us. We're in the Q&A now. Would you like to take one?
Yeah, sure. Sorry about that. Had a call I had to take. If I may, the president's speech last night was pretty impactful, at least from my perspective. A lot of commitments that he made. And you already mentioned the May 1st deadline. You feel pretty comfortable about that. Was there anything that you're concerned about? We're hearing that the Oakland Coliseum is not offering first doses right now for a period of time, from what I understand. And so I guess I'm concerned. I think our business community is concerned that, just the vaccines aren't quite getting here as fast as we thought. So just wanted to get your overall impact of the president's speech last night, if I may.
Yeah, but first of all, I from a public health standpoint, the federal government over the pandemic has sent some mixed messages, and I feel like it was a little more clear cut last night. These are the things to do to keep you safe, but also optimistic. We're getting to a place where the things are probably going to be much better. And I thought it was how to put it, aggressive is the wrong word. It's an optimistic goal, but I like that. I feel like it puts pressure on us locally to really keep the ball moving and do everything we can to get people vaccinated and be able to when that eligibility opens up, have it be meaningful, So it's one thing to say you can get a vaccine, but another thing to have an appointment. I do share the concern that you mentioned, Steve, about supply. Our supply has been flat for weeks now, and we're told maybe it'll continue to be flat or small increases for the next several weeks. And then in April, it'll start to go up quite a bit. We've had promises of increased supply before that haven't really panned out. I mean, we went up through the month of January, and then it's been pretty flat since then. So I have to be honest, we need the vaccine in order to really do this. And the faster the vaccine comes, the faster this process will go. A couple things. I mean, we're getting Johnson & Johnson now. That has not resulted in increased supply yet. Our hope is that it will eventually, but you only need one shot with Johnson & Johnson. So there's kind of a hidden bonus buried in there. There's no coming back in a month or anything like that. So that'll start to have a benefit in about 3 weeks. And then the state is tinkering, as they have been throughout, with how vaccine is distributed. It's not clear how that's going to affect Alameda County yet. It doesn't change the overall supply across the state, but it hasn't. For now, it seems that the upshot is we're staying flat. We're getting the same amount of vaccine every week. And I think up until probably this week, we've been able to avoid just doing second. We've been able to keep the ball rolling on first doses. Right now, it's tricky. We really do need to get those second doses into people, and we don't control the Oakland Coliseum site, but I'm not. I mean, that's just where we are right now. They gave a lot of first doses over the last month, and now they got to give those second doses, and that leaves only so much room for first doses. I'm optimistic for April.
Thank you.
We are no.
Okay.
Well, we're getting comments obviously from our event planning industry, so deeply affected during this period of time. They've never been able to really do anything. They've been doing a little bit. There was a window of time in there, but not nearly at the level at which they need to be profitable. So we're seeing some questions come in on that. This one question says, without guidelines for weddings and events, and I looked and I haven't seen anything, and with the opening of Disneyland and with people being allowed to attend baseball games soon, do you see the state giving guidelines for weddings and events? And yes, it's been a year and the industry is in need of immediate relief. Any conversations going on about that?
So yes, absolutely. I had the opportunity to be in a very small group with state staff. Hear me? Okay, I'm back. So I had the opportunity to be with some pretty senior state health staff, and I elevated this very issue. I said we have people in our county whose business depends on private events, and they want to plan in advance. So where's the guidance? And so they know that's come up in other quarters. Weddings, people know you're going to get married in the summer. You need to be planning now. And so that has been communicated by, I think, multiple jurisdictions up to the state. And I do expect that. I know they're working on guidance all the time, and I do expect we're going to see some specifics around these areas. Graduations as well. That is another thing in the pipeline. Everybody's had a lot with vaccine going on at the same time, but these are absolutely valid concerns, and we need clear guidance. And I know the other thing is the state is trying to be more consistent now across sectors. That's where they've really gotten slammed by the courts. If it looks and smells like something that's open, it should be open with similar rules in place. And so I do think we'll see more. I'm hopeful that's going to mean some opportunities for safe operations this summer for certain types of events. Food and drink, which I know is a big part of it, that's going to be, there are going to be capacity caps that are pretty strict tied to food and drink. But I think if we're in the, orange and yellow tier, there'll be a little bit more opportunity. So I would say that's the one note of caution I have for the events industry, is that the state has signaled that it's not going to be wide open for food and drink anytime soon. So, I know that that's probably not ideal from a business standpoint.
Okay, well, I understand we have a ton of questions in the chat, so let's kind of try to rifle through these. Do you know anything about the green tier the governor mentioned on Tuesday?
I do not. I think green tier probably is, really getting back to much more, many fewer restrictions, but I haven't seen it sketched out anywhere. So, we'll see. I think if things are, I'm trying not to focus too much on that super low tier so much as let's get to a place where we can drop most of this stuff.
Great. Did we ask Michael Teague's question, Dawn, at the very top?
Yes.
Okay. So Ron Adams asked a question that I think you talked about earlier, Dr. Moss. To what extent do masks actually protect the wearer as well as others? Can you review that one more time?
Yeah. So I haven't reviewed the evidence recently. I will tell you that the basic principles are, it depends on the mask, and certain types of masks offer more protection than others. They have to be snug fitting around the nose, mouth, under the chin. And if they're cloth masks, 2 or even 3 layers, or 2 layers with a filter, which could be like a paper towel or a vacuum cleaner filter, or people, now you can get kind of nice masks on Amazon and stuff. Those do appear to provide some filter protection to the wearer, in addition to protecting the people around you. Surgical masks provide some, if they're snug fitting. There are respirators, N95s, that we healthcare providers use in certain situations, not all situations, and they are commercially available. Those offer very good protection, but they have to be fitted to your face, and they're a little uncomfortable to wear all day. I know, because I've worn them, because you're actually breathing through a pretty heavy filter. If they're working right. So, most people don't need that level of protection if we're following the other guidance. But a good snug mask, multiple layers if it's cloth, is important. You are hearing a lot about 2 masks right now, or double masking. That offers more protection if you're doing it right. So, from my standpoint, the most important thing is a good snug fit, and at least 2 layers if it's cloth, and you're going to be in pretty good shape.
Okay, our friend Tracy Farhad at Visit Tri-Valley. For April 1st, does indoor live events mean, meetings, weddings at event venues and hotels with limitations? Are small meeting guidelines on the county's blueprint? And how can we help these industries prepare for April 1st reopening of these restrictions?
We're still waiting for that. I think that's going to come later this month, the indoor stuff. I will tell you, almost certainly it's not going to be food and drink to start. So for the hotels, it's going to be probably, I think what we're talking about is indoor small meetings with outdoor food service, if you can swing that. But I haven't seen that guidance yet. And, I think the state realizes they have to put it out. So hopefully we'll get more in a matter of weeks.
Okay. And she also has another one on the Johnson & Johnson 1 dose. Is that immediate benefit, or is that a 2-week wait as well?
I think it's 2 weeks for Johnson & Johnson. I think you need 2 weeks before it's full efficacy. So it's a good rule of thumb. the longer you are out from any of these vaccines, the more protection you get, up to about 2 weeks.
Thank you.
I'm not sure if it's my turn, but I do have a follow-up question on the Johnson & Johnson. Is you mentioned the efficacy about the South African variant. What about the other two?
The other two vaccines, we don't have clinical data yet, so we don't really know the answer to that. Yeah,
Okay.
I think we're hopeful. Moderna is testing a booster that's designed specifically against that variant, and Pfizer is, I think, doing the same. But the important thing to remember is, there's certainly concern based on some things that we know about some of the mutations with that variant. But until we get the clinical data, I think, there's a good chance that we're going to get at least decent efficacy, particularly against severe disease and hospitalization. And so, I'm not without hope that we'll be just fine. But I think it's prudent for the companies to be looking at strategies.
Great.
And I'll just say there's also one other thing. There's also the 2117, formerly the UK variant, that is, the CDC said would spread widely in the US. The vaccines do appear to be pretty effective against that. I haven't seen data for Moderna yet. Pfizer and J&J definitely, but Moderna and Pfizer are going to be very similar. So I don't think there's cause for concern with that variant, which is expected to very likely that we'll have a lot of it.
Gotcha. Okay, I'm going to roll two questions into one here. They're kind of similar. Ron Adamson asked, when can 17-year-olds get the vaccine? And then Rhonda wants to know, how do you prove your documentation that you have a chronic illness to be vaccinated?
17-year-olds, if they're eligible, for example, restaurant workers or other, there's a few other maybe occupational places a 17-year-old might be eligible. They can get it now because we have a vaccine that's approved for down to age 16. Otherwise, we're probably looking at that May 1st timeline, maybe a little bit earlier in California, mid-April at the earliest, but probably in May. It's going to be kind of all ages eligible. And then the second question, remind me, Steve?
Was what kind of documentation is required to prove that you have a chronic illness to get vaccinated? Yeah, so
the state just overnight put out some guidance around this, and we before this call, I was in our internal discussion about how we're going to handle this. The goal is we want to be cautious. We don't want to just throw the door wide open and have anybody who, it has to be a little bit higher than just, I think I need vaccine. But it can't be too high because we want to make sure people who need vaccine can get it and don't have to jump through a lot of hoops. And we want to make sure that people can get through the sites quickly, as I said before. So it's going to be, it's not quite final yet, but it's going to probably be sort of a pretty straightforward, relatively easy level of documentation or self-attestation. And we will hopefully have more on that later today or early next week for Alameda County.
Great.
Okay. Does Alameda County have a youth sports guideline similar to the California Department of Public Health guideline? It may help youth sports organizations get access to fields and facilities, which has those families out supporting.
Yeah, the state guidelines are our guidelines. I know there's a few areas where the state points to the local health department or where they haven't provided much. I think the main one is that the testing requirement for certain high-risk sports is a bit vague. I have to be honest, we're going to make it as simple as possible. And if we have to pick a testing time frame, we're going to try to peg it to what some of the college sports do. But otherwise, it's really what it says in the state guidance is what applies here. For certain sports, high contact sports already operating, football, rugby, those are good examples. You really need to have like a college sports like approach. It's pretty stringent, but you can operate. For other things, it's pretty straightforward. And the state guidance is not that long. If you're concerned, I urge you to do a thorough read, and then you can reach out to Safe Learning at acgov.org. Safe Learning at acgov.org. That's our schools and youth team, and we're happy to try to address any gray areas.
Okay, I have a question about travel. If you're vaccinated and where you're going, or if you go out of the country and you come back and you're required to have a COVID test, if you're vaccinated, are these rules, do you think they're going to change, or do you think you still need to get those COVID tests even if you have your little vaccine card?
So for international travel, CDC has not yet changed their guidance, and I think that means you will need to test to come back in the U.S. And also, if you want to, Hawaii requires a test. I don't know when they're going to change their policy, for example. In other situations, CDC has said vaccinated people who don't have symptoms don't need to test. There is a chance for breakthrough infections. The vaccines are not perfectly effective. And so if you're sick, you should get tested. And you shouldn't travel. I think that we probably will see some changes to travel guidance at the state and federal level soon, but people aren't quite ready to make those. So it's still, regardless of vaccine status, we recommend against travel. All those scary variants that we've had in Alameda County, they've all been travel related, and at least the ones we know about. And travel does present risks. It's not the risk of sitting on an airplane. It's not the risk to you. It's the risk that a place where there's out of control transmission, that we're bringing that back to Alameda County where we have things under control. That's the real concern with travel. I really recommend against it for the time being, regardless of vaccine status. This will change in coming weeks, but that's where we are today.
Great. Quick question here. I think an easy one. If I work in Alameda County but live in Contra Costa County, can I cross borders to get vaccinated when eligible?
Yeah. So I think Contra Costa may be having the same approach, but our policy up to now has been if you live or work in Alameda County, you can get vaccine here. And so, if you're occupationally eligible, we want to just have you we have asked for most folks to bring some documentation of that in, and it's fine. And we did this right from the start with healthcare workers. A lot of our healthcare workers live in Contra Costa County or other counties. So that's not an issue for us. I would defer to Contra Costa County for their rules.
Okay, we have Amy, who's the president of their community swimming pool. Are there specific guidelines for opening? For example, capacity, best practices, sharing of furniture, opening bathroom showers, open swim lessons, etc.
Yeah. We have a swimmer on staff, on our policy staff, and we have definitely tried to make sure that we're following the state guidance, and where it's not specific, we've tried to do some practical things. I'm going to refer you to that team. So that's COVID recovery, all one word, covidrecovery@acgov.org. Send them an email and say you have a question about pools, and we can take a deeper dive. Sorry for the metaphor with you.
Okay.
Whose turn is it? Mine?
It's your thing.
Yeah.
Okay. Tracy, she's full of questions today. Can we skip a tier? If our numbers are low enough for 3 weeks, can we jump?
No.
I have to be honest. I don't think so, but it's been a while since I read the fine print of that. There are some weird wrinkles in the state's guidance, and so I don't think so. I think we got to go through orange to get to yellow.
Next question. Our organization runs a charitable bingo hall. We have the capability of requiring advanced purchases and assigned seating. What category would we fall into as far as when we can open indoors?
It's either going to be family entertainment or indoor live events. And I'm not 100% sure. I know in the past, we raised this with the state. I think it was under family entertainment. That's also a question you can direct to COVID recovery at acgov.org, covidrecovery.org, covidrecovery@acgov.org. And we can help clarify. But it's going to be probably one of those two categories. Assigned seats is great. We really like that.
Mm-hmm.
Okay. From Carolyn, do you anticipate that guidelines on gatherings will change and evolve as the vaccination rates increase?
Yes, I do. I think we're going to get more. Right now, in purple and red, it's still 3 households. I think that's actually going to change this month. It's not going to be wide open. But I think it's going to change, and the state is going to come into alignment with what CDC has said, which is if you're vaccinated and I'm vaccinated, we can get together indoors and have a meal, things like that. So yes, that will change.
Okay, Gina wants to know, where does the garbage and recycling workers fall as they encounter every resident in their service route area every week, and they sort through all the residents' materials each week? I'm assuming this is a vaccine question. Where do they fall in the vaccine world, eligibility world?
I don't believe they're eligible. I could be wrong. The state added some stuff last night. For example, all janitorial workers are now included, but I don't think that group was included. We are working, with some of the labor representatives in the county, and I think they'll let us know for sure if we're missing something, for at least for any represented workers. I have to be honest. The faster we can just get to everybody, the better. I think adding individual groups turns out to be operationally very difficult, even though the state has done some of that. And we just need to get folks vaccinated. If they're eligible for one of the other reasons, then that's great. But I think they're not eligible right now. Most of that work is outside. Much of it's not face-to-face. The risk of getting COVID from the actual materials is very low. So not to say that there isn't potential impacts, but that's where we are today. And I have to be honest, there's a lot of folks who probably are at some risk from their work who are not eligible and are just going to have to wait because the system is not perfect.
Thank you. This is from Lindsay. Who can we contact? And I think you've already answered this. Who can we contact regarding more guidance involving the wedding industry? It's peculiar that outdoor and indoor dining is permitted, but outdoor receptions with modifications are not permitted. So sort of back, I think you've already answered this, but perhaps you could again, please.
Okay, so the state sets these policies. We know that they need to provide more guidance around weddings. I do think indoor dining, indoor private event dining is going to be limited to smaller groups when they come out with that guidance. But outdoors, I agree. They will probably have to bring it into some kind of alignment with outdoor dining. So I look forward to seeing that soon. And I know you need to plan for the warmer months. And so, we are messaging those of us who represent counties where, we have this industry. We are giving that message to the state. But I don't think we've got updated guidance for that yet. So just hopefully in a matter of weeks.
Okay. What about, this is from Jessica, what about congregate meals for seniors? Do we have to wait until we get to the lowest tier to start these programs again?
That is a good question. We probably, if it's indoors. Meals indoors is a super high risk. Seniors are a high risk population. Only half of them have been vaccinated. That's a tough one. It's a tough area.
Okay. Question from Craig. Please address office reopening schedule, particularly in Dublin.
Oh boy.
I think
good question. I think, hold on, let me see if I have this right in front of me. Personal worship. Restaurants. The long list. Offices. Orange tier. Open indoors with modifications. Encourage telework. That's me encouraging you to telework. So when we hit orange, they will be open for non-essential businesses.
Great. I think that's the last question in the chat. Jamie's asking for vaccines. Will they open in age increments? For instance, 60 to 64 as opposed to ages 18 and up. How's that going to work? Do you have any idea?
I haven't heard from the state, and we're rapidly getting close to that May 1st thing. So the state went with the 16 to 64 with chronic conditions first, and then they have signaled that they're going to go to age band. So it may be that April 1, we would see probably more than that, maybe 50 to 64. But I don't know for sure what the next age band they're considering is. And I know that they're going to want to, it probably is going to be more than 60 plus, but maybe that's the approach they'll take. So if I were to guess, in probably about 2 weeks, we'll know what the next strata is.
Okay.
Stratum.
If you get the vaccine and felt ill the next day from it, are you contagious? Should you stay home?
Absolutely not. You're not contagious. There's no vaccine. There's no COVID virus in any of these vaccines. You're not going to give anybody COVID from any of them. Some of us do get a little sick for a day, maybe a day or two, occasionally longer. That's your body's immune system doing its job and getting trained up to repel a real infection. And so that's okay. Many people don't really have any problem at all. I personally was vaccinated. I had 1 day of feeling kind of cruddy after the first shot. After the second shot, I had a headache in the evening and really nothing else. That was the Moderna vaccine. So there's a chance you'll feel cruddy, but you're not going to give anybody COVID. You cannot get COVID from these vaccines. That's not how they work.
Okay, I have a question about breweries and wineries. We've heard you say that Alameda County is aligned with the state rules. If we're in the red tier, can breweries and wineries open outdoors with modifications starting tomorrow? I.e., is the county following the state activities?
We are, that's right. So I think wineries may have already been allowed. And what happened was breweries and distilleries but not bars. Breweries and distilleries are now being brought into alignment with wineries. As I said, the state is trying to be more consistent. Makes sense. Effective tomorrow, the 13th. And there are restrictions. I believe it's tables, reservations. So not standing. You have to be seated at tables, reservations, and 90-minute time limit, and outdoors. There may be one or two other things in there. So you got to do all those things, but otherwise, you're going to be able to open tomorrow.
Great. So a couple questions I'm rolling in together. One's from Christine. She wants to know how your baby's doing. And then the second question is, my kids are asking me if we can expand our social bubble. And I think you sort of answered that. But first of all, I hope your baby's doing well. And if you could answer the second question, that'd be great. Thank you.
Sure. So my baby's doing great. Thank you so much for asking. Yeah, I wish he was handy, but he's in a different room and probably sleeping or something. So the current gathering restrictions are a little bit, they haven't changed much yet, but they're a little bit more relaxed than the sort of bubble thing. So it's 3 households, outdoors only. It's the fewer households you mix with, the safer it's going to be. But I think it's fine if it's different households this weekend from next weekend. I think we're at a place where that's probably okay. And I do think the state's going to loosen these up a little bit more. But that's where we are today. So 3 households at a time, outdoors only. And I think it's okay if you mix and match those households a little bit.
Okay, from Esther. Please discuss school reopenings throughout the county, especially in light of Berkeley's return to school at 5 days a week, full time, shortly. And I know in Livermore, ours is on March 22nd that they return to the classroom with a hybrid option if the family so desires. So what's going on countywide, Dr. Moss?
I mean, that's a good summary. Schools are able to open. They're slowly getting there. It's required a lot of labor agreement and negotiation. This has been one of the most challenging areas really across the country. The state has leaned in a lot, including I think the governor and the legislature reached a deal to provide funding to incentivize schools to open, public schools. If they get open this month. And so, that's a great carrot. The federal government, the relief plan, $1.9 trillion relief plan signed yesterday includes money for schools. I think $15 billion for California schools. I'm not sure exactly what that's paying for yet, but, a range of things. So, people want to get schools open, and I'm hopeful that we're going to see more and more districts get open. It's not easy. You have to put some work into making it work for your families and your school community. But I think we're slowly getting there. A lot of educators and school staff have been vaccinated in Alameda County. I don't have an exact count. Turns out it's hard to get that because people are getting vaccinated all over the place. But we estimate something. This is a week ago. It was 2/3, something like 30,000 of our 45,000, K through 12 staff or something like that. So, that's just an added layer of that's been put in place to get school staff back. And I'm optimistic that we're going to see more and more, especially as, more districts figure it out. That puts pressure on the districts that haven't figured it out yet. So.
Okay, a follow-up to that is the 6-foot distancing required for schools. Is this prohibiting many from opening?
You know what? Anytime there's a rule related to schools, it becomes an issue of controversy and a potential barrier. So the actual rule is no less than 4 feet after you make a good faith effort at 6 feet. So you try for 6 feet. If you can't make it work, go for 4 feet. And what I've said is, it's okay to err on the side of getting kids back in school more days. even if that means you're closer to that 4-foot thing. But you got to try. You got to use your space creatively. Figure out who's going to be back in school. It's not impossible. Schools have done this, and so I think some people have tried to make this into a bigger bear. Listen, I know it's hard. I'm not the person on the ground trying to figure this out, but every single time a rule has come out with regard to schools, it's been turned into this insurmountable barrier. Districts are figuring out how to do this. It can be done. The state has heard from a lot of places that this is, relaxing things around this would be helpful. So that could come, but I think schools can make it work and just make an effort at trying to do it. Marin County has created some diagrams with standard sized classrooms about how you can organize desks and meet some of these requirements. And so, I know it's work, and I know it's a point of negotiation at schools, but it's doable. It's not real, it's not the barrier that I think it's sometimes made out to be. And I know, easy for me to say, but nevertheless, I really encourage people to dig in, get creative, figure out how to get kids back in.
Oh, Steve, you're on mute.
It had to happen once. Okay. This is from Kelly. When do you think we will hear about the arrival of the Cal OES mobile clinic for HPI, high risk census tract in Livermore? I think you mentioned this earlier. So there's the question for you.
Kelly Bowers, by any chance?
It is. Yes, Kelly Bowers.
Hi, Superintendent Bowers. We have been trying to work with the superintendent to support vaccination in Livermore, not just for schools, but for the eligible occupational tier folks and others from communities out there that have actually been disproportionately impacted. We have a community out there in Livermore that has seen some of some of the more severe impacts of COVID. I think I mentioned this in my slides, and you might have missed it, but the state is not going for Livermore with their mobile van. At least that's my understanding. We'll keep asking for that, but we may have to come up with another solution. I have not been working on that personally, but I know others have, and I do anticipate that we're going to get something out in Livermore. This whole thing has moved slower than we'd like in terms of county operated pods, in part because of the Coliseum and having to work with Cal OES on how they deployed their site. And I was a little disappointed that they felt like Livermore was too far, but I don't have any more insight into that. So I think it's going to happen, but it may not be the Cal OES mobile van.
And Dr. Bowers follows up with a comment here that the school district and the city of Livermore and LARPD, which is our park district, just had a very successful one-day mobile clinic in partnership with the regional Walgreens at the Robert Livermore Community Center, and they administered the Johnson & Johnson vaccine. Yay.
Oh, that's great. I'm so glad to hear that. I know that we've had some other cities have had some successful pharmacy partnerships, and so that's terrific.
Okay. And is there a way to sign up for vaccines that may go to waste from missed appointments? Any intel there?
Yeah, when I last checked with our team, we had not had to waste any vaccines. So I think you can design your vaccine clinics in a way that's not a huge issue, but it does take some work. So we've been able to do that, and I don't think to my knowledge, we haven't wasted a single dose. But you hear about, like, the end of the day appointments, things like that. I mean, the fact is that, we're never going to make that a sort of a formal thing, because then you get lines around the block and people get upset and all that. So we've much more focused on planning appropriately and making sure that we're able to use all our vaccine doses, and that has worked out fine for us so far. Can't speak for the pharmacy or state sites. We don't run those, but I think it's not been a huge issue yet.
Okay.
And by the way, as these eligibility rules relax, it's not going to be relevant anymore. So maybe that's a few more weeks, but there are going to be enough people who are eligible.
Okay, Maria is asking you to repeat the COVID recovery website address again, please.
Yeah, it's an email account, and it's COVID recovery, one word, at acgov.org, acgov.org is our Alameda County email domain.
Awesome, thank you. That's the last question we have.
I have a kind of a follow-up to the question about the vaccines left over at the end of the day. I know there's been some recent reports about volunteering to help the vaccine centers, not so much giving vaccines, but directing traffic and parking and all that good stuff. And I actually participated in that at Washington Hospital with my son because he works there, and we were able to get vaccinated. So can you tell us a little bit about that? How do you find information about that? Because I'm sure there's a lot of folks that would be interested in doing that.
So this is great. So vaccine has been an incentive to get volunteer staff to work at vaccine sites. We do it, but it's really limited so far to county employees. We haven't opened it up to I think community volunteers, and I believe there's a link on our Alameda County vaccine website for people who are interested in volunteering or signing up to get more information about that. I'll see if I can give you the right web address for that. And this is a good resource for everyone. It was on my slides. So COVID-19.acgov.org/vaccines. COVID-19.acgov.org/vaccines. And I believe you can actually, I think there is information about volunteering on that site, might be towards the bottom. But the state has also signaled an openness to taking on volunteers, and that's I'm not sure what the stat. I heard that there are very limited opportunities available, so I think that got swamped pretty quickly. It's probably worth reaching out to local healthcare providers like Washington Hospital and others if they're nearby to see if they have volunteer need. But we do have a sign up sheet on that website that I gave, and when those opportunities arise for county residents, we'll do some outreach. That's where we are.
Okay, and I will note for everyone that each of the chambers have on our websites, we have a tab or a page that does have resources for our businesses related to the COVID, and with lots of links that take you to the county website as well as to the state website and in some cases the CDC. But again, the county website, I look at this constantly. I'm constantly looking at this page because things are being posted almost daily, updates, and it is covid-19.acgov.org, and lots of information there. Additionally, we do send out, I know our chamber does a weekly SIP, and that is for the universe. And we usually have the latest information that's been released on anything related to COVID and businesses, as well as our livermoreupdates.com website that we set up in week 1 of the pandemic. And that's purely COVID resources for businesses. And so each of our chambers have resources for our businesses, always taking you back to the official sources of information. So let's see here, we've got 9 minutes left. I don't see any more questions in the chat. Oh, wait.
It's a repeat.
It's a repeat, yeah.
Okay, all right. So do any of my partners here have any closing comments or questions for Dr. Moss before we let him close out his comments?
I have one, Inga, if you're good. So we saw the recent update on the state's shared portal. I think that's called SPOT is the acronym for businesses that actually have employees that end up getting COVID. How can you just report on, is that working? Are you seeing a lot of those, or any advice to our employers out there on utilizing that service?
Yeah, I mean, I think this is a good move by the state to try to get things a little bit more organized around businesses reporting, which has been, I know a challenge and complicated. I have not had much hands-on experience with it. And so I would really look to our business community to say what their experience has been. I think we just moved to it a week or two ago from our prior reporting system. And I know our team was kind of working still on transition. Right now, things are much better overall because there's much less virus around. So that really helps. And I think the question is, do we get another surge anytime soon? And how does it work during that? But I don't have much insight into kind of how it's going, other than I'm glad that the state is kind of taking over in this regard. So sorry, I can't shed much more light on it.
Thank you.
Okay. Well, Dr. Moss, do you have any final closing comments here before we?
Just, I'm glad to be back and part of this conversation, and glad that we're at a time of more optimism right now. And, we're almost to a year since the Alameda County state of emergency was declared. And I feel like the county's in an okay place, both today and just in terms of how we've handled things overall. And I hope that we're able to build on that and get us through what I hope is maybe the last chapter, or at least things will drag on for a while, I'm sure, but the last kind of phase where our lives are really disrupted by this thing. So.
Yeah. Thank you. Well, things are looking very promising right now. We will, a major indicator that the economy is heading into recovery is when the schools begin to reopen for in-classroom education. So we're pretty happy, but I think we need to recognize the fact that recovery will take some time, and that we still must be cautious and, exercise some due diligence on our practices. And we will continue to support businesses until every single one of those restrictions are lifted. We want to be sure that we can continue to connect our businesses with access to the resources that they need to sustain until the last restriction is lifted. Well, we appreciate your partnership with us. And then we look forward to coming back to you in about 6 weeks for our next webinar, which hopefully will be in the orange tier at least, probably not the yellow tier, but maybe getting close. So thank you, Dr. Moss. Thank you, Inga Houston and Steve Van Doren, for being with us today. And everyone who's watching, this video will be posted on our websites for you to look at and to share in your network. Give us about a day or so, and we'll get that posted. With that, everyone, stay safe. Wear your face covering, wash your hands, and socially distance, and we will get through this together. Thank you.
Dr. Moss. Thank you, Don.
Bye,
Thank you, Inga.
Bye.
Thank you, Jody. Bye.
Have a nice weekend.
Yep.